Recovered coronavirus patients may hold the key to a potential cure, as doctors in at least 9 states now use their donated plasma to help others get better. The FDA now ramping up efforts to make it more accessible. Here to explain, FDA Commissioner Dr. Stephen Hahn. Dr. Hahn, good morning to you.
Good morning, Steve. Thank you for having me.
It's great to have you as well. So how does this plasma work?
So this is a really interesting therapy that has potential for helping people. What you do is you take the plasma, and that's the liquid portion of the blood, from someone who's recovered from COVID-19. So had a diagnosis and then recovered. And in that liquid portion of the blood is the natural immunity that the body develops, the antibodies against the virus. If a person donates that plasma, it gets processed, and up to 4 people can receive that plasma. And what that does is transfer that natural immunity to someone who's sick with the illness. This is a very straightforward. It's been done in other outbreaks before, and for the last several weeks we've allowed this to occur through what's called an expanded access program. So 875 hospitals, 755 physicians around the country have already signed up for this, and we really encourage those Americans who've had the COVID-19 virus to donate plasma, and they can do that either through their local blood bank or through the Red Cross on their webpage.
Well, that certainly could be a game changer. I'm looking at your webpage, and you talk a little bit about hydroxychloroquine. And we just had the governor of the state of South Dakota with us just a little while ago. They are actually doing a trial in her state. Listen here to Governor Kristi Noem.
I announced yesterday, in partnership with our 3 major health systems, that we would do the first ever statewide, state-backed clinical research drug trial on using hydroxy for these COVID-19 positive patients. We have the opportunity, with the help of the federal government and of having enough doses that we could treat up to 100,000 people in our state, and that's going to allow us the opportunity to have a therapeutic that could make all the difference in the world for those that are high risk or vulnerable.
Okay, so that's what's going on in South Dakota. I'm looking at your webpage, fda.gov, and it talks about how the FDA has now issued guidance on the creation of generic versions of this hydroxychloroquine. So clearly, the federal government thinks this is something that could be a game changer.
So there are some reports that hydroxychloroquine has some effectiveness in this disease. They aren't definitive yet, but that's why these clinical trials are so important. And my hat's off to Governor Noem and the other states around the country, and also academic centers that are doing these trials. I think it's important to point out that the evidence supports performing these trials, to ask the question, and Dr. Fauci is seeing those data to look at the safety and the efficacy of this approach.
Okay. Perhaps not a game changer yet, but there is hope in that. Also, I was reading about a new saliva test where apparently it's as simple as, for instance, a medical worker once a day, perhaps twice a day, would spit into a tube, and then that would be analyzed. How would that work?
This is actually a really important development, and Steve, it highlights the great innovation that we've seen around the country in response to the outbreak. So this is an authorization that we gave to Rutgers Lab last night. And what it does is, you described it perfectly. You can use saliva rather than the swab in the nose. It's more comfortable for the patient. Obviously, it can be repeated multiple times. And it's actually safer for the healthcare provider in terms of collection. What's really important, Steve, here is that this is not an at-home test. This still has to be performed with a provider, but it does provide great advantages moving forward and expands the opportunities for testing.
Absolutely. And businesses, when they get around to reopening, they could actually do that, have their employees spit in a tube, analyze it, have the results the next day, and then if they are sick, they would know much earlier. Dr. Stephen Hahn from the FDA, sir, thank you very much for joining us today.
Thank you, Steve.
All right. Our third hour of Fox and Friends, we got Dr. Oz and Senator Lindsey Graham. They're both with us. Coming up next live.